Outbreaks of viruses are a part of life, but there's one that has been making waves in recent months. Human metapneumovirus, or HMPV. You might have heard about it in the news, but what exactly is it? And why is it important to know about it right now? In today's video, we're diving deep into what HMPV is, how it spreads, and what you can do to protect yourself and your loved ones. Hi everyone, welcome back to our channel. If you're new here, don't forget to subscribe and hit that notification bell so you don't miss our future health updates. In today's video, we'll be covering the basics of HMPV and exploring the recent outbreak that has been affecting many communities. Let's get started. So, what exactly is HMPV? It's a respiratory virus that affects the lungs and airways, similar to the flu and respiratory syncytial virus, or RSV. It was first discovered back in 2001, but it's been quietly circulating ever since. Now, though, more cases are being reported worldwide, and that's why it's on everyone's radar. HMPV is primarily spread through droplets in the air, like when someone with the virus coughs, sneezes, or even talks. It can also survive on surfaces for a short time, so touching contaminated surfaces and then touching your face can lead to infection. This makes it easy to spread, especially in crowded places. So it's very contagious, and most people are infected by the time they're adults. The good news is HMPV typically doesn't cause severe illness in healthy individuals. But in certain groups, like the elderly, young children, and those with weakened immune systems, it can lead to more serious complications like pneumonia or bronchitis. Now let's talk symptoms. How do you know if you've contracted HMPV? The signs are pretty similar to other respiratory infections, which makes it tricky to distinguish just by symptoms alone. Here's what to watch out for. Fever, coughing. Nasal congestion. Shortness of breath, wheezing, sore throat. These symptoms can range from mild to severe, and while most people recover in about a week or two, it's important to be cautious if you're in a higher risk group. If you or someone you know is experiencing trouble breathing or persistent high fever, seek medical attention immediately. Now let's discuss the recent uptick in cases. While HMPV was initially found in small clusters, health experts are noticing an increase in reported cases over the past few years, especially in the winter months. In fact, the 2024 to 2025 season has seen a spike in hospitalizations related to HMPV, with many cases occurring in the US, Europe, and parts of Asia. In the US, for instance, health authorities have reported a higher than usual number of cases in the late fall and winter, which coincides with the flu and RSV season. This overlap can make it difficult to differentiate between these illnesses, but one thing is certain: healthcare systems are under pressure. This outbreak has triggered some concern, especially since HMPV shares symptoms with other viral infections that are also circulating. But don't panic. While the rise in cases is notable, it doesn't necessarily mean the virus is more dangerous. What's important is that hospitals and healthcare workers are prepared to manage the influx of cases effectively. So, how can you protect yourself from HMPV? It's pretty similar to the precautions you take during flu season or during other viral outbreaks. Here are some tips to stay safe. Wash your hands frequently with soap and water for at least 20 seconds. Use hand sanitizer when soap isn't available. Cover your mouth and nose when coughing or sneezing, preferably with a tissue or your elbow. Stay home if you're sick. Don't spread the virus to others. Clean and disinfect commonly touched surfaces regularly. Wear a mask in crowded places if you're feeling unwell or are at higher risk. And if you're in a high-risk group, make sure to avoid crowded places during peak infection periods. It's always better to take precautions and get medical advice if you feel uncertain. On the bright side, scientists and healthcare workers are on top of things. Researchers are working to better understand HMPV and how it behaves, which could lead to vaccines or antiviral treatments in the future. While there's no specific treatment for HMPV right now, healthcare providers are focused on symptom management and supportive care for those with severe symptoms. In the meantime, public health authorities are monitoring trends and advising on containment strategies like quarantining those who are highly contagious and offering additional guidance for hospitals. Though it's still early in terms of a vaccine, the fact that there's a growing awareness of HMPV is definitely a step in the right direction. Research into respiratory viruses is advancing, and that could help prevent larger outbreaks in the future. So there you have it. Human metapneumovirus, or HMPV, is a contagious respirator.